Good morning. It's Friday, March 13th, so it must be time for another update from your North Carolina Medical Society. Wow, it's definitely feeling like a Friday the 13th with a lot of interesting stuff going on here in North Carolina. I want to connect you back to our last Political Pulse video where we really focused on elections. So we are so thrilled to announce that Dr. Kristen Baker from Cabarrus County, who won the primary election just a week or so ago, has been elected by her county officials to take over Linda Johnson's seat that had been expired. So she will fulfill that seat in the unexpired term of Representative Linda Johnson. So she will be moving forward, the incumbent for that seat. So we are so excited to welcome her to Raleigh for the upcoming short session and any special sessions that may be called moving forward. So let's get right to the topic at hand that's on everybody's mind that you can't turn on the news without hearing, and that's coronavirus. So the World Health Organization has declared this a pandemic. And also, you've probably seen that the governor declared a state of emergency this week. And that was not to invoke a sense of panic amongst North Carolina citizens, but to help us draw down some federal resources, to also coordinate some scarce resources that we have, and to also make sure that consumers don't suffer from some price gouging. So we were kind of seeing that with the disinfectant wipes and the hand sanitizer that's no longer on shelves. So that state of emergency declaration ensures that consumers are protected from some price gouging that we had been seeing. Also want to point out that the North Carolina Medical Society is putting together resources for those of you who are interested in doing telemedicine. Maybe your practice has not done telemedicine before, but now think that you need to start doing that. We're pulling together resources, being proactive on our website, trying to get information from different sources so that you have a place to go to if you're interested in doing telemedicine moving forward. I also want to commend the North Carolina Medical Board. Due to the state of emergency declaration by the governor, they have allowed inactive or retired licensees within the past 24 months to get a temporary license due to the state of emergency for coronavirus. So if that's you fit into that category, you can apply for a temporary license to help take care of patients during this trying time. I also want to point out that we will have a number of resources for you in morning rounds from the CDC and the North Carolina Department of Health and Human Services. And this is really just to make sure that you all have the most up-to-date information both from the North Carolina level and from a national perspective. And we'll be updating that as quickly as we get that information in on our website, in morning rounds, and on social media as well. Now, if you remember from last week, we had a joint legislative oversight committee on health and human services and then another one later in the afternoon on Medicaid. But most of the discussion in both of those committees was really centered around coronavirus and legislators wanting to know what the state was going to do on coronavirus and some of the needs that needed to be addressed. So that was the main focus. If you want to know more of the details from that committee on some of the other topics, visit our blog. We have a summary on both the Health and Human Services morning meeting and specifically on the Medicaid. We also want to give a shout out to Blue Cross Blue Shield and North Carolina Medicaid for covering telemedicine services during this time. That's something we've been working for, pushing toward. Think that that's good for patient care, particularly when we're trying to contain this virus as much as we can. So please stay tuned. We'll be giving you all the up-to-date information on this as we get it in. Thank you so much for what you're doing, taking care of patients each and every day, and we look forward to talking to you next week.